In today's lecture, we are going to start next unit, drugs acting on ANS, that is autonomic nervous system, in which firstly you have to know about what is ANS. Then in this unit, we see the sixth chapter. First one, parasympathomimetic, parasympatholytic, sympathomimetic, sympatholytic, mydriatics, and the meiotic, in which parasympathomimetics, they are also known as cholinergic drug, and parasympatholytic, they are also known as anticholinergic drug. Sympathomimetic, they are known as adrenergic drug, and sympatholytic, they are known as antiadrenergic drugs or beta blockers in the sympatholytics. Then mydriatic and meiosis. These are the drugs which act on the eye, that is pupil size. Either it is increased or decreased. In which we are going to start first chapter, parasympathomimetic, that is cholinergic agent. Before that, we studied in short what is ANS, in which the nervous system is classified into PNS and CNS. CNS, it consists of brain and spinal cord, where PNS, that is peripheral nervous system, it is further divided into two branches, efferent and afferent. Efferent is motor and afferent is the sensory, in which efferent divided into two classes, first one ANS and second one SPNS, that is somatic peripheral nervous system, in which ANS is involuntary, which is again classified into three types, in which parasympathetic, sympathetic, and enteric. Autonomic nervous system include these branches, parasympathetic, sympathetic, and enteric. It consists of myelinated preganglionic fibers and which forms synapse with the cell body, and non-myelinated, then second neuron, which is termed as postganglionic neuron, and postganglionic fibers, they are turns to terminate in the synapse with the receptor organ which is supplied by it. Synapse means in between the pre and postganglionic fiber. The space in between postganglionic and the preganglionic fiber is termed as ganglion. Synapse in between the pre and postganglionic fiber is termed as ganglion. While synapse in between the postganglionic fiber and the receptor, synapse in between postganglionic fiber and receptor is termed as neuron effector junction. Means synapse जर pre-ganglionic and post-ganglionic fiberच्या in between असेल, that synapse is known as ganglion, and when synapse in between the post-ganglionic fiber and receptor is termed as neuron effector junction. Sound is audible to all?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Okay. So ANS, it is classified into two divisions, majorly two, and next one is enteric. First one parasympathetic and second one sympathetic. Where parasympathetic, it is inhibitory, while sympathetic, it is stimulatory. And these two divisions are state of the dynamic equilibrium. Parasympathetic nervous system, which is mainly play important role in the tissue building reaction, while sympathetic nervous system, which prepare their individual to adjust stress and prepare body for the fight. So parasympathetic, जे parasympathetic nerve fiber आहे, on that जे drug act करतात, that is parasympathetic drugs, and those drugs which block the parasympathetic nerve fiber action, that is parasympatholytics. Similar for sympathetic, those drugs act on the sympathetic nerve fiber are known as sympathomimetic, or show similar response to the sympathetic nerve fiber are known as sympathomimetic. Mimetic means similar or the same response, while sympatholytic means they are opposite to the sympathomimetic. Parasympathomimetic opposite parasympatholytic असतात, means they antagonize action of each other. Parasympathomimetic category in which cholinergic drugs, that is acetylcholine, and in parasympatholytic atropine, means acetylcholine and atropines are the antagonists of each other. While in sympathomimetic there is adrenergic agent, or it is also known as adrenergic drugs. There are examples adrenaline, isoprenaline, and in sympatholytic we have to study what is beta blocker, that is drugs acting on the heart. ANS, in short, introduction समजले?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am. ANS under CNS or PNS,
PNS.
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 that is human nervous system. It is mainly divided into two broad divisions, that is central nervous system and the peripheral nervous system. Peripheral nervous system is further divided into two branches, in which first one efferent and afferent. That is efferent again classified into ANS and somatic, autonomic nervous system and somatic nervous system, in which drugs acting on ANS, they are the parasympathomimetic or sympathomimetic. All of you, in short, introduction of nervous system and what is ANS, understand?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am. Okay, synapse in between postganglion and preganglion is termed as, postganglion and preganglion fibers is termed as
Postganglionic
two
fiber.
terms. First one,
Postganglion
synapse,
fiber.
synapse in between the pre and postganglion fiber is termed as ganglion. And when synapse in between the postganglion fiber and receptor, then it is termed as neuroeffector junction. The preganglionic neurons of the sympathetic system, their origin from the cell bodies in the thoracic and lumbar vertebra of the spinal cord. Then the preganglionic neurons of the parasympathetic systems have their origin from their cell body in the lower brain, cranium, and in the sacral portion of the spinal cord. The synapse in between preganglionic fiber and the postganglionic fibers are known as ganglion. Screen is visible to all.
Yes, madam.
Ma'am.
Yes, ma'am.
Parasympathomimetic and cholinergic agents. Same name for the parasympathomimetic is cholinergic agents. Cholinergic means these are the pharmacological agents which show similar effect like acetylcholine. Main drug of parasympathomimetic category or cholinergic category is acetylcholine. These are the pharmacological agents which shows similar effect like acetylcholine is known as cholinergic agent or cholinergics. Then next parasympathomimetic. These are the pharmacological agents when which administered exogenously means externally. Then they show response similar to parasympathetic nerve fiber stimulation is known as parasympathomimetic. Parasympathomimetic means these are the pharmacological agents. They show similar response or mimic response to the parasympathetic nerve fiber stimulation. The parasympathetic nerve fibers stimulation होतं. At that time, they shows the response. Like same response shows parasympathomimetic agent. So this mimic response is known as those agents which shows this mimic or similar response. These agents are known as parasympathomimetic agent or cholinergic agents. If this definition related to sympathomimetic, then you have to say These are the pharmacological agents which when administered exogenously, then they show response similar to sympathetic nerve fiber stimulation. It is known as sympathomimetic. जर sympathomimetic असेल तर sympathetic nerve fiber stimulation असणार आहे. If there is parasympathomimetic, then sympathetic nerve fiber stimulation. So cholinergics are the pharmacological agent. They show similar effect or response like acetylcholine is known as cholinergic. And second, parasympathomimetic. These are the pharmacological agents. When they administered exogenously, then they show response similar to stimulation of parasympathetic nerve fiber is known as parasympathomimetic. All of you got the definitions of cholinergics and parasympathomimetic.
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Yes, madam.
Yes, ma'am.
Parasympathomimetic shows response similar to stimulation of which fiber, which nerve fibers?
Parasympathetic nerve fiber.
Parasymptomatic nerve fiber.
Nerve fiber.
Means जर का parasympathomimetic agents असतील, at that time they shows response similar to stimulation of parasympathetic nerve fiber. When we studied sympathetic, then they shows response similar to the stimulation of sympathetic nerve fiber. Just parasympathetic is still at that time parasympathetic nerve fiber, and when sympathomimetic at that time sympathetic nerve fiber stimulation. All of you got a definition of cholinergics and parasympathomimetic.
Yes, ma'am.
Yes,
Okay.
ma'am.
Major drug in cholinergic agent or parasympathomimetic is
Acetylcholine.
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 Encoding.
roll number 28.
Yes, ma'am.
What is cholinergics?
Cholinergic. These are the pharmacological agent which shows similar effects like acetylcholine is known as cholinergic.
29. What is parasympathomimetic? Roll number 29. Mane Arki.
Yes, ma'am.
What is parasympathomimetic?
These are the pharmacological agents which, when administered exogenously, then they show the response similar to the response of the parasympathetic nerve fiber stimulations is known as a parasympathomimetics.
72. Roll number 72. Sound is audible to all?
Yes, ma'am.
Yes, ma'am.
72 roll number. Sneha Kamble.
Yes, ma'am.
What is parasympathomimetic?
These are the pharmacological agents which, when administration, response of pharmaceuticals nerve fiber stimulation is known as patho.
Repeat it from administered. These are the pharmacological agent which when administered
These are the pharmacological no,
Exogenously means anyone?
Externally.
Externally.
These are the pharmacological agents which, when administered externally, then they show the response similar to mimic response to stimulation of parasympathetic nerve fiber is known as parasympathomimetic agents or cholinergic agents. And cholinergics, again, these are the pharmacological agents. They show similar effect to the acetylcholine is known as cholinergics. The next classification of parasympathomimetic agents are cholinergic agent, in which first one esters of choline. Their example ACH, that is acetylcholine, carbachol, methacholine, benthacol. Then second class cholinergic alkaloids. Their example pilocarpine, arecholine, muscarine. Then synthetic compound. Their example putrescinium. Then next class. Fourth class cholinergic choline esterase inhibitor, in which two subclasses. First one reversible anticholine esterase and second irreversible anticholine esterase. Reversible anticholine esterase example neostigmine, physostigmine, pyridostigmine, and next one irreversible acetylcholine esterase, their example organophosphorus compound. This classification of parasympathomimetic agents. Roll number 32. Sound is audible to all.
Yes, ma'am.
Yes, ma'am.
Roll number 32. What is parasympathomimetic? Are you present? Screen is visible to all.
Yes, ma'am.
Yes, ma'am.
Parasympathomimetic, in which majorly four classes, in which first one esters of choline, second one
Polygenic alkaloids.
Alkaloids.
Synthetic compound.
Synthetic compound.
Next last one is choline
Collagen
esterase
esterase inhibitors.
classes, reversible anticholine esterase and irreversible anticholine esterase. How many classes of cholinergic agents?
4 classes.
For classes.
Four.
First one is all of you. First class of parasympathomimetic.
Ester of choline.
Ester of choline.
Example AS carboline.
AH carbachol, methacholine, methacholine,
Acetylcholine, carbachol.
Carboline, methacholine आणि methacholine.
Second class.
Polygenic alkaloids.
Their examples
pilocarpine,
Pilocarpine,
muscarine,
pilocarpine, arecholine, muscarine. Third class.
synthetic compounds,
synthetic
Synthetic
compound.
compound.
Example
Putrescinium,
deuterium.
Next class.
Cholinesterase inhibitors.
In which first class.
Reversible antichlorine esterase.
Their
Example
example.
example neostigmine,
neostigmine,
neostigmine, pyridostigmine.
fibrosine.
Second class.
Irreversible
Irreversible
anticholinergic.
anticholinesterase. Example,
Example of
phosphorus compound.
phosphorus compound.
So parasympathomimetic majorly classified into 4 classes. 68 roll number. Roll number 68, 32. Are you present? Sound is audible to all.
Yes, ma'am.
Yes, ma'am.
Pharmacological actions of acetylcholine, in which firstly acetylcholine has 2 types of the receptor. First one is muscarinic and second one is nicotinic receptor. Acetylcholine is combined with the muscarinic as well as nicotinic receptor and produces pharmacological actions. Means acetylcholine having actions on the 2 receptors. First one is muscarinic, second one is nicotinic receptor. Muscarinic receptors are present or located on the heart, blood vessels, smooth muscles of eyeballs, smooth muscles of GIT tract, exocrine glands or exocrine system. Then nicotinic receptor. Nicotinic receptors, they are present on the skeletal muscle, adrenal medulla and autonomous ganglionic effect. That is autonomic ganglion, in which firstly we discuss pharmacological actions of acetylcholine on the muscarinic receptor. These muscarinic receptors are present on the heart. Therefore, acetylcholine shows their action on the heart. Acetylcholine depresses sino-auricular node, that is SA node, and reduces conductivity, contractility, atomicity, rhythmicity, and depresses the AV node conduction, and which leads to reduce the heart rate, that is decrease in the heart rate, and also decrease in force of contraction. Acetylcholine, which is binds to the muscarinic receptor of the heart and which produces depression of SA node, and due to which there is impulse generation is reduced. Due to the depression of SA node, impulse generation is reduced and which causes decrease in the heart rate and decrease in the force of contraction. Then next, action on the blood vessel. Heart वर action काय आहे acetylcholine ची? About heart rate and force of contraction. It is increased or decreased?
Decreased.
Increased.
That is acetylcholine depresses to the SA node and they shows decreased or reduced heart rate and force of contraction. Then action on the blood vessels, that is also BP. Acetylcholine vasodilates to the blood vessel, thereby causing decrease in the peripheral resistance, and output is the decrease in BP. That is acetylcholine causes dilation of blood vessel, which leads to decrease in the resistance of the blood flow. Resistance of blood flow get decreased and which leads to decrease in BP. Decrease in BP, it is termed as
Potential.
hypotension. So hypotension effect observed on the blood vessel. On heart, there is decrease in the heart rate and decrease in force of contraction. Decrease in heart rate, it is termed as
Bradycardia.
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 Bradycardia. Then action of acetylcholine on the smooth muscles of the GIT, gastrointestinal tract. Acetylcholine increases tone and motility of the GIT due to there is peristaltic movement. If peristaltic movement gets increased, means it increases GI tone and motility of the GIT. Therefore, there is peristalsis movement is get increased. This effect of acetylcholine on the smooth muscles of GIT. Okay, first two वर decrease effect आहे and smooth muscles of GIT in which increase the GI tone or motility of the GIT. Then next action on the smooth muscles of eye. It shows meiosis or spasm of accommodation. Meiosis, it is also termed as spasm of accommodation. There is decrease in the pupil size. It is termed as meiosis. Next chapter, JH unit मध्ये आहेत mydriatic and the meiosis, in which meiosis means there is decrease in the pupil size and mydriasis means increase in the pupil size, in which those drugs act on the meiosis or they produces meiosis is known as meiotic. And the agent which produces mydriasis, that is increase in the size of pupil, is known as mydriatic, in which acetylcholine shows action or effect on the smooth muscles of eye is meiosis effect. What is meiosis? Increase pupil size or decrease?
Decrease.
Decrease pupil size.
Then next action on the exocrine gland. Acetylcholine stimulate these glands and by their it increases all the types of secretion. Means by stimulation of this exocrine gland, acetylcholine increases all the types of secretions like intestinal, pancreatic, lacrimal, bronchial, and gastric secretion increased by stimulation of this exocrine gland. This is all about pharmacological actions of acetylcholine on the muscarinic receptor. These muscarinic receptors are present or located on the heart, blood vessel, smooth muscles of GIT, and also eye, and on the exocrine gland, in which pharmacological action on the heart. Heart rate and force of contraction get
Decrease.
Decreases.
then
Decreases.
on blood vessel,
Decreases.
Dilation.
hypotension, dilation of the blood vessel, it produces
Hypotension.
hypotension or
Hypotension.
hypertension.
Hypotension.
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 Okay, on smooth muscles of eye,
Increase the GIT.
Increase the
smooth
peristalsis.
muscles of eye
GI
will
tone
also
increase.
decrease the pupil size.
Decrease the
Pupil size increases.
And on the smooth muscles of GIT, there is increase the GI motility and increase the tone. Exocrine gland, in which also stimulate to this gland and increase the all the types
All
of
types
secretion,
of
that is
secretion.
secretion.
gastric, intestinal, pancreatic, lacrimal, bronchial secretions are increased. Means increased effect on smooth muscles of GIT and on the exocrine gland. Otherwise on heart, on blood vessel, and on the smooth muscles of eye. Acetylcholine shows decreased effect, right? Reduced effect.
Yes, ma'am.
That is
Yes, ma'am.
inhibitory effect. Then next, pharmacological actions of acetylcholine on the nicotinic receptor. In which first one, effect on the skeletal muscle. Screen is visible to all.
Yes, ma'am.
Yes.
Yes, ma'am.
Acetylcholine stimulate to the skeletal muscle, hence there is contraction of the skeletal muscle and which improve the power of skeletal muscle. But when it is given the high dose, it causes Paralysis of the skeletal muscle. Acetylcholine shows stimulatory effect on the skeletal muscle. Acetylcholine stimulate to the skeletal muscle, therefore contraction of skeletal muscle is occur and it improve the power of skeletal muscle. But when it is in the high dose, it causes paralysis of the skeletal muscle. Means also acetylcholine shows stimulatory or increasing effect on the skeletal muscle. The next effect on the adrenal medulla. Acetylcholine causes stimulation of adrenal medulla, hence increase the secretion of adrenaline, and which increases the blood pressure. Increase in BP, it is termed as
Hypertension.
Hypertension.
okay. Muscarinic receptor मध्ये हायपोटेन्शन होतं की हायपरटेन्शन होतं.
Hypotension.
Hypertension.
Hypertension.
Action on the blood vessel.
Decreases blood pressure.
Increases blood pressure.
Acetylcholine shows dilation or vasodilate to the blood vessel and therefore decrease the peripheral resistance and hypotension is observed. While effect on the adrenal medulla, acetylcholine stimulate to the adrenal medulla and increases the secretion of adrenaline. Because of increase the secretion of adrenaline, it is in the sympathomimetic category, and acetylcholine, it is parasympathomimetic category. When acetylcholine increases secretion of adrenaline, it is present in the adrenal medulla, and which increases the BP. MCQ is asked on this point. Either BP is increased or decreased. What happens in adrenal medulla?
Increases
Increases the blood pressure.
blood
Pressure.
pressure.
Then next, autonomous ganglionic effect means acetylcholine, which shows their action on the nicotinic receptor in which they are located or present on the autonomic nerve ganglion, which causes stimulation of the postganglionic nerve fiber and which release the acetylcholine, and due to the release of acetylcholine which leads to contraction, and that contraction is get increased. This effect of acetylcholine on the autonomous ganglionic nerve fiber. Acetylcholine produces contraction on the nicotinic receptor. We have to write 3 actions, pharmacological actions, in which first one, skeletal muscle, in which acetylcholine stimulate to the skeletal muscle and there is contraction of skeletal muscle is observed. And when acetylcholine is given in the high dose, then what happens?
Paralysis.
Paralysis of the skeletal muscle is observed. Then next action on the adrenal medulla. There is increase the secretion of adrenaline, therefore increase in the BP. And on the autonomous ganglion, that is autonomic nerve ganglion, on which acetylcholine causes stimulation of the postganglionic nerve fiber and which releases the acetylcholine, and due to which, that is release of acetylcholine, shows contraction is get increased. This pharmacological action of acetylcholine on the nicotinic receptor. All of you understand pharmacological actions?
Yes, ma'am.
Write the pharmacology of acetylcholine. This question is asked for long answer question, in which you have to write actions on the muscarinic receptor and the nicotinic receptor. In muscarinic receptor, 5 pharmacological actions, and in nicotinic receptor, 3 pharmacological actions. After that, side effects, bradycardia, the side effects from the pharmacological actions. Bradycardia, hypotension. Bradycardia, it is acetylcholine, pharmacological action of acetylcholine on the heart, hypotension, then meiosis, diarrhea, and dysentery. That is, acetylcholine increases the GI motility and GI tone, increases peristaltic movement. That is, they produces diarrhea. Then peptic ulcer and dyspnea. These 4 side effects you have to write from the pharmacological action, and remaining 2 you have to remember side effects of acetylcholine, dyspnea, and peptic ulcer. Then next, organophosphorus. Organophosphorus compound. It is example of which class? Organophosphorus compound. Sound is audible to all?
Fourth class.
Cholinesterase inhibitor.
inhibitors.
Irreversible anticholinesterase. Their example, organophosphorus compound. Organophosphorus compound poisoning. It is next point in parasympathomimetic chapter. Before organophosphorus compound poisoning, all of you understand pharmacological actions and the side effects.
Yes, ma'am.
Roll number 8.
Yes, ma'am.
Side effects of acetylcholine or parasympathomimetic.
First one, bradycardia. Second, hypotension. Third, meiosis, spasm of accommodation. Fourth, diarrhea. Okay. Diarrhea, dysentery. 5, peptic ulcer. Sixth, dyspnea.
Dyspnea is difficulty in the breathing. Then next, organophosphorus compound poisoning. Side effects and pharmacological action. Doubt आहे?
No, ma'am.
No, ma'am.
Okay. Organophosphorus compound poisoning. Organophosphorus compound under the class irreversible anticholinesterase, in which causes of organophosphorus compound: barbiturate poisoning, morphine poisoning. Then third one is organophosphorus compound poisoning. This poisoning we have to study in same pattern: causes, symptoms, and their treatment. In which causes, first one is occupational cause, second suicidal cause, and third one is accidental cause. Means organophosphorus compound poisoning is occur by accidental cause, suicidal cause, or occupational cause. Occupational cause means if there is person is engaged in the spraying of insecticide, then this poisoning is occur. Then accidental, in which by consumption of agricultural product they are sprayed on the insecticide. They are sprayed with the insecticide. Then organophosphorus compound poisoning is observed, and suicidal with the intention of suicidal purpose. When organophosphorus compound is taken or administered, then organophosphorus compound poisoning is observed. The next symptoms, in which first one bradycardia. The symptoms are from the side effects or pharmacological actions of acetylcholine. Bradycardia, meiosis, hypotension, diarrhea, urination, excessive secretion, and excessive sweating. Excessive secretion from which pharmacological action?
On exocrine gland.
Means they stimulate to the exocrine gland, and there is increase all the types of secretion, that is excessive secretion. These are the symptoms observed when the organophosphorus compound poisoning is occur. Bradycardia, meiosis, hypotension, urination, diarrhea, excessive secretions, and excessive sweating. After that, treatment: hospitalization, gastric lavage, endotracheal incubation. These are the same from the as that of barbiturate or morphine poisoning. हे 3 points झालेत त्या poisoning मध्ये. Yes or no?
Yes, ma'am.
Yes, ma'am.
Prompt hospitalization, gastric lavage, that is removing of the toxic content from the stomach or cleaning out the stomach. Then endotracheal intubation. Then antidote. This is important for the MCQ and also in organophosphorus compound poisoning. Atropine sulfate 1 to 2 milligram by IV route through the saline solution. This is antidote for organophosphorus compound. Roll number 42. Screen is visible to all.
Yes, ma'am.
Yes, ma'am.
Roll number 42.
Yes, ma'am.
Which antidote is used for organophosphorus compound? (42, 41). Which antidote is used?
Atropine sulfate.
Their dose, their route.
1 to 2 mg by IV route.
What is antidote? Anyone?
Against the action of
What is antidote? These are the chemical agents which counter or neutralize the effect of another drug or poisons are known as antidote. Antidotes are the agents or the chemicals that counter or neutralize the effect of another drug or poison. Physical, chemical, and also many more types of the antidote, in which for the organophosphorus compound poisoning, the antidote is used atropine sulfate. Their dose is 1 to 2 milligram by IV route through the saline solution. Then next, enzyme reactivators, in which before that rule number 41. Survase.
Yes, ma'am.
Which antidote is used for organophosphorus compound poisoning? (41). Which antidote? Anyone?
Propyl sulfate.
Propane sulfate 1
Proper 1 to mg by IV route.
saline solution.
Saline solution.
This one asked for 1 mark question. Drug of choice or write the antidote or for MCQ. The next enzyme reactivator in which two drugs are used, in which obedoxime, their dose is 250 mg and pralidoxime 1 to 2 gram by IV route. Then next treatment, administration of IV fluids, saline solution. If the necessary, patient should kept under the nursing care. If the condition of patient or organophosphorus compound is occurring in critical condition or if it is necessary, then patient should be kept under the nursing care. This is about treatment of organophosphorus compound poisoning. All of you understand organophosphorus compound poisoning, their causes, symptoms, and treatment.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Which antidote is used for organophosphorus compound poisoning?
Atropine